Great. So moving on, the access to veterans care is probably one of the most significant things that you hear about. When I think about veterans care, I think about three words: access, access, and access. And that's probably the biggest gripe I hear among veterans when they talk about VA care. Um, and one of the issues that you're tasked with taking on is internet access itself. When it comes to, as we described, the digital divide at the top.
Yes.
So as a department, as an agency tasked with finding new and innovative ways to care for veterans, how do you approach the digital divide? What are some of the challenges posed, and how are some of those challenges met in this, post-COVID world?
Yeah, so there's a couple of major challenges. One is obviously the fact that we have our caregivers or our healthcare providers. They're not evenly spread across the country. It's what we say kind of lumpy. We have big concentrations of healthcare providers in different places. This is true of every healthcare system. So, for example, that's a challenge for us in VA because we have a lot of rural veterans living in rural communities, and not just VA, but in fact, the entire American healthcare system faces challenges with shortages of healthcare providers in rural communities. So one of the ways we address that is by dramatically expanding, since the start of the pandemic, telehealth. Now, telehealth can mean anything from actually getting on the phone with your healthcare provider to getting on a screen, as you and I are now on the screen. With on my end, if I were the vet, would be a healthcare provider, and then there'd be a specialist on the other end. We have seen an explosion in the use of telehealth during the period of the pandemic. In March 2020, there were about 2,500 telehealth appointments a day. By 1 year later, March 2021, there were 45,000 telehealth appointments a day. That's a massive expansion. And the good news is it allows us to meet our veterans where they are, including in rural communities, and it allows us to get them specialists and expertise directly with them. Two last points. I was in Kansas with Senator Moran very early in my tenure as Secretary of VA. And I was talking to a veteran who was talking about the mental health care that he was receiving. And he made the point that because of telehealth, he was able to get access to a mental health care professional in Manhattan. And it wasn't Manhattan, Kansas. It was Manhattan, New York City. And that's the beauty of telehealth, because we have concentrations of healthcare providers in places, and the telehealth vehicle allows us then to bring that directly to our veterans wherever they are. Last point. There's a major challenge in all of this, which is beyond our control, which is access to 5G or access to broadband. This is why we are so excited about the president's infrastructure plan. And we're so grateful that the Department of Commerce, under the leadership of Secretary Raimundo, is going to make sure that once and for all, we solve this digital divide. Once we're in that position, then there'll be no limitations on our telehealth capabilities. And we'll be in a position where we can actually reach vets no matter where they are, even in those very rural settings where they don't even have access to broadband.